meeting. We will begin this meeting by pledging allegiance to the flag. Please join me, everyone. I pledge allegiance to the flag of the United States of America and to the republic
for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Ooh, we have a coordination challenge, but at least we all said it, right? Thank you very much. Next item on our agenda is to approve the minutes for our meeting of January the 15th. I know they're a little bit more lengthy than some of you would normally like, but very important information on there about COVID, and I thought you might all be able to use that detail in constituent response. So I hope you've had a chance to read them, and do I hear a motion to approve them? Oh, let me ask first, are there any corrections, additions? Hearing none, is there a motion to approve them?
So move.
Is there a second?
Second.
Second, thank you very much. Okay, now we will move on to the next item on the agenda. I had tentative conversation about the pandemic. I wanted to always reserve a spot in the event that there is new information. We have had a very robust conversation during the past week about some of the challenges we face. So I think we're all fairly updated on that. However, there are a few new pieces of information I thought I would announce in the event that you all haven't seen that. According to County Executive Gardner, 84% of the vaccinations that are available in Frederick County have been distributed, and the remaining will be distributed by the end of the day today. Again, I thank you all for that very productive conversation, identifying the problems. You have to know what the problems are in order to be able to address them. And as the federal government develops a strategy, I do believe it will help us in some of the challenges we're facing, because since the state isn't receiving notice, the local governments don't receive notice. And so it becomes very difficult to plan. County Executive Gardner sent us a news release that we shared with the delegation. If you recall last week, she had a number of asks, and some of those have been met already, allowing local government some flexibility in moving on to the next priority groups. One other announcement I wanted to make to the delegation and to the public today is that Senate President Bill Ferguson has formed a work group to, on a weekly basis, look at the allotment process for vaccines and provide some oversight through asking questions. In addition to Senator Ferguson, there are 5 senators on that work group. I'm very happy to see that Senator Young was appointed to that work group, because to me that meant Frederick County has a seat at the table, or maybe not literally, we have a corner on the screen, but that means that we should be able to voice our local concerns at the state level.
Madam Chair, I have my hand up. I don't know if you saw that.
No, I didn't.
Okay, and this has to do with pandemic issues. Is that what we're talking about now?
Yes, that is.
Okay. So my question is, if I can put to you the fact that the governor has ordered in one of a different word, schools be back in session, at least in a virtual manner, by March 1st. So I would like for us to stay on top of that locally as to where we are in Frederick County, because that is so important to our constituents, as is the vaccine distribution. So I remember last week when we talked to the superintendent, she told us that she needed about 8,000 doses of vaccine for the for Frederick County Board of Education employees and staff, teachers, etc. So I want to bring that to Senator Young's attention, because I think that that is important to get us back in school. But I think we need to know, and we may want to bring a representative of the teachers union in also to find out where we are in getting the children back to school. Even if it's in a virtual manner, hybrid approach, you know, what is the, what's the plan? Because I don't know what, I know that they have said February 16th is what they're working towards, but I would like an update. So if you can arrange for the superintendent to be in attendance, I would appreciate that.
We will be asking the superintendent and the county executive and Dr. Brookmeyer on a weekly basis if they would like to update us. And I would encourage you all to communicate specific issues directly to Senator Young.
Now, I understand that, but this is a public meeting.
Okay.
You know, me getting my questions answered is not the same as the superintendent being able to tell everybody what the plan is in a public meeting.
We will invite her. Senator Young, would you like to respond? And then we do need to go to Delegate Pepe, who has his hand up.
I spoke to the acting Secretary of Health last week. The information he has from the county that we're approaching 50% of the vaccines we've gotten are in arms. And he said we're one of the higher counties right now. We will be meeting with him weekly. That's the purpose of our group. We're going to be meeting with him weekly. He is up for appointment. He was rejected once previously. And the agreement is now, and he's aware of it, we want to see how this moves smoothly ahead. And if he's doing a really good job, then his appointment will probably go smoothly. And if not, there will be a lot of discussion about it. But I will bring up the question of, are we getting vaccines out for the teachers next week? And any other item that anyone would like me to bring up when we meet.
That'd be great. One thing before we go to Delegate Pepe, I want to remind the public that you can comment on the YouTube live stream if you have any questions or concerns. Delegate Pepe.
So like many of you, I saw the announcement that, if I'm not mistaken, the county is going to stay in distribution category 1A. And I'm just wondering, looking at the folks that are in 1B, I mean, the teachers are in 1B, correct? So, the governor moved the teachers further up to get folks back to school safely. And, obviously there was an announcement yesterday, there seems to be a lot of pushback. And now we find out that the county is going to just decide to stay in category 1A. And I mean, it kind of goes back to.
I think that's erroneous. We do have County Executive Jen Gardner. That's not how I read it, so I'll let her elaborate.
All right, well, I'll ask the county executive a question in a minute. So I just want to make sure that, we're to Senator Young's point, we're on top of, the distribution. We're not dragging our feet because I do think parents want kids to return to school in person safely. And that means prioritizing teachers et cetera. So I just want to make sure collectively as a group and as a county that we're doing what we need to be doing to make sure that that happens. So happy to hear any comments or feedback from the county executive. Thank you.
Okay, I just do want to let you know that Frederick County is at yesterday morning, at the beginning of the day, we were at 84% of our vaccine were in arms. And by, tomorrow we will have 100% in arms. We did have a technical glitch with transferring data into the state system, and that has been cured. So each week we will get out 100% of what we get. So if we get it on Monday or Tuesday, by the end of the week, we will have all of it distributed. We did decide to stay in 1B. 1B is assisted living, which is happening through CVS Walgreens, and 65 or 75 and older. So we prioritize 75 and older off of a Maryland Department of Health directive that was who we should do first. So prior to the governor's announcement yesterday, I had checked with Steve Shue, who's my contact in the governor's staff, and told him we were going to stick with 75 and older. And he said, that's fine. And then the governor made his announcement about schools. So I texted him last night and said, we've announced 75 and older, we're going to continue with that unless we hear otherwise. So, and the reason for that is because most of the deaths are in people 75 and older. They're the highest risk people. So we are getting about 1,900 doses a week. Giant Foods is supposed to, and Kingfisher Drive, which is there off Maryland 26, is supposed to be starting to do whatever they're going to do with vaccines next week. Their allocation is going to come out of our allocation because there is no more vaccine. So we will actually get less next week. So we probably have something like 8,000 more potential people over 75 to do. Between us and the hospital this week, we'll have done about 2,800 people over the age of 75. And then we did 300 last week, so that's about 3,000. So we're trying to make progress through that. So, maybe in a week or two, we will change, but right now, the focus is on public health, and that's what Dr. Brookmeyer and I have decided to do. Now, if we got 4,000, 5,000 doses, we would certainly be able to start teachers and school staff, but based on the information I have, we are not going to get any more than our average of 2,000 or less. I don't know how much is going to go to Giant for the next 2 or 3 weeks. So whatever choice you make to distribute it, it's not enough for it. So we could say we're going to put 500 to 75 and over, and 500 to 65 and over, and 500 to the school system, but you're still going to take weeks and weeks and weeks to get them done. We did have an issue last week with the first day we had 75 and older. We had lines at one of our locations. That was a combination of issues of people showing up an hour and a half or more before their appointment time. The state registration system went down. We had another issue. And so we've resolved all those issues, and we've had really good experience this week. And I've had a lot of compliments this week from seniors who have been going through the process. So I do want to say the issues that we had last week, we resolved. And we're going to have bumps in the road in the future. We are prepared to open a drive-through when we have, again, a volume of vaccine. And, the first day we open that, we'll probably have some issue that I don't know what it is yet. But so people will have to be a bit patient with us. But I will say we're getting tons of emails, tons of calls. We set up a call center with 15 people on Tuesday of this week. The first day they got a couple thousand calls. They have signed up, at least as of yesterday, 500 seniors on the phone by helping them do it, do the application. The registration system itself is a real frustration, because by the time you get to the end, you pick your slot. And if your slot is now full, if it filled up between when you started and when you ended, you have to start over again for another day. So I've had complaints about that from seniors. That is the state system. I passed that particular complaint on more than a week ago. And, but the call center and the pre-registration process has helped. So you can always have people go to the health department website and pre-register. And we're going to start pulling out of that group for next week's vaccinations.
I see that Dr. Brookmeyer has joined us. Welcome,
Okay.
Brookmeyer. Is there anything you would like to add to the conversation?
I'm sorry that I missed the first part of it. We now have 19,000 people pre-registered, And the interest of the pre-registration is so that people don't have to keep checking the website, and so that when we do have scheduled appointments available, it can be the numbers of people who receive that information to schedule can be more closely aligned number-wise with the actual appointment slots that we have available. And as the county executive had said, that we have scheduled for this week we have scheduled appointments to match 100% of the doses that we have received, the first doses that we've received to date. By the end of last Saturday's clinics, we had some left over that did allow us from appointments that weren't kept to allow us to start a clinic on Tuesday, to schedule that prior to knowing when we were going to receive our vaccine. We did receive, thankfully, the vaccine Tuesday in time for us to have additional doses that day, so that we could open up even more appointments on that day. So I'd say, and we are in close coordination with the hospital as well. And I'm not sure if county executive was able to speak to the hospital, but they have their own outpatient medical group. And so they sent their own emails directly to their enrolled patients in their outpatient medical practice who are 75 and older.
I see Delegate Krim has her hand up.
Thank you, Madam Chair. So, sorry, just bringing it back to Senator Young and the work group in the Senate. If the senator could bring up the fact that the governor has ordered, and I keep putting that in quotation marks because I don't know exactly how that's supposed to work with local control, but how are the local LEAs supposed to get these kids back in school if we don't have vaccine for the teachers? So if there could be a discussion about that, because there seems to be some kind of disconnect. Maybe, does the governor expect the teachers to go back without having the vaccine? I'm not sure about that. I would just like that clarified in the work group, please. Thank you.
Okay, anyone else? I don't see any other hands. So unless I get a text from Ben or see someone waving, Delegate Cox.
Thank you, Madam Chair. I guess this is a question for someone from the county. I remember last week there was a statistic shared about the number of teachers who had decided to not receive the vaccine. Could someone refresh my memory on that issue and how many teachers may be willing to go back to work without the vaccine at this time?
Yeah, so you might have heard that from me. What I understand from Dr. Albin was out of the 8,000 and some individuals who work for FCPS, there are about 6,000 FTEs, but about somewhere in the order of 8,500 persons actually work for FCPS. From the initial survey responses that they received, there were about 4,000 individuals who said that they wanted to receive vaccine. Then when we go to the non-public schools, we have a number that is upwards of 400 potentially who want to be vaccinated from non-public schools. And then from the childcare, so when we're talking about that whole education category, so it is K through 12 public and non-public. So we have about 4,000 for the public school. For the private schools, some number, it could be close to 400, not quite sure yet from each of them. Then we also have in that category licensed childcare providers, and the Maryland State Department of Education has surveyed them. I have not received the county specific survey responses to know how many of them are interested. We have over 200 licensed childcare facilities in Frederick County. So many of them are home childcare, so there would just be one or two persons perhaps from each of those, but that remains to be seen what that interest is. And then most recently, higher education is now added to that education group, some portion of higher ed. And I don't have those numbers for our local colleges because that information just came out last night that higher ed is now in that education group or some numbers. So when we're looking at the amount of vaccine allocation that we're receiving. And if we're looking in that 1B group just for education, you see our number is 5,000 at, I'd say at least, so we might be looking at 5,000 persons. It's going to take a long time to get through those 5,000 if we still have 1,000 in the 1A category. So what's been helpful with our pre-registration system is that we've been able to get better information about who's still out there waiting for vaccine. And in the 1A category, out of our 19,000 pre-registered, 1,000 indicated that they're in 1A. And then when we look at 1B and the 75 plus category, so besides the countywide demographic statistic of maybe 14,000 individuals, maybe 10,000 of them not in a long-term care or assisted living, we have 4,000 who are on our pre-registration list. So 4,000 persons who are 75 plus 1,000 who are 1A. And I'm anticipating that our allocation will be no more than what we received last week, which for the first doses, which was 1,900. And now, as the county executive had said, with Giant Pharmacy coming on board this week, I am expecting that their allocation is going to be coming out of what the health department would otherwise receive. The hospital gets the Pfizer, and the Pfizer, either you get the 975 doses or you don't get any. They're not breaking up the boxes. So for them, they either get 975 or they don't. But for the health departments, they come in much smaller quantities in the boxes, so they can more effectively break up the distribution for the local health departments. And for the Frederick Community Action Agency, I'm not sure what their plan is for how much they'll be receiving this week and whether their allocation will be increased or decreased. But if their allocation increases or decreases, my understanding is it's going to then, if the Community Action Agency's allocation increases, I'd expect that the health departments will decrease commensurately.
Yeah. The other thing I would add to answer Delegate Cox's question is we have in 1A, so maybe the hospital had 68% of their staff stand up to get the vaccine on the first round. Then when they see that there has been no negative reactions, more people come in. We've seen that in every group. So that's why we still have 1,000 people in 1A to do, because we thought we were done. But whether it's firefighters or healthcare workers, or even in the nursing homes, the first run, some people will say, I'm going to wait and see what happens. And so about 20% of the people turn into a yes after they see other people move forward. So that, I just want to know that percentage is not flat. And then when we add people age 65 and older, which are in 1C, that will add another 40,000 people. So you can see we have a lot of people in the queue who are clamoring for a limited amount of vaccine.
Thank you. And so I guess just to follow up, at this time, although that curve is not flat, we do have about 50% of the public school system that is willing to possibly work without the vaccine. They have not indicated that they want the vaccine at this time. They might change that. It might be a fluid thing. And then another thought that came to me that kind of dovetails off of Delegate Pippi's question last week in terms of any vaccines that are left over at the end of the day. I know we had talked about the way that you're prioritizing first responders. Is there a way to have teachers also be available for on-call for those leftover vaccines so that they're not wasted?
Yeah, that's certainly a possibility. There's also, we are going through a variety of scenarios, again, trying to think about the equity with it, with public schools, non-public schools, and all the other individuals who are in group 1A and 1B. So for each day, we still have had a list of individuals who have indicated that I'm in that eligible category and I want to be on a wait list if you have some available doses. So this week, because of the way that we had been scheduling prior to having the pre-registration process accelerated and now live, for this week, we still have a wait list for each day for individuals who qualify, so we can easily call for them. Then when we switch to next week, where we are pooling from the pre-registration list, I think that's something that we're still considering, the people in that 1A or the 1B category, being able to call them and see, can they show up in 15 minutes? So it's one of those things where ideally we'd be working with an entity that would commit that they'd let their staff know, okay, so you're the next 10, you're the next 9 up. And if you are called today, you need to show up at the vaccination location in 15 minutes or you've missed your chance and you can go, back into the regular pool from that employer. So it's something where it would be most efficient if the health department doesn't have to call each individual and wait for something, if instead their employer would manage it. So if we would be going through the 1B category that has the occupational, the occupational group. So, that could work. Not sure we're continuing to work over the weekend, but we will not be wasting any doses. I read whatever was in the newspaper, that was not Frederick County. We go above and beyond to make sure that every single dose, including the vials that sometimes you can get an extra dose out of them, depending upon which type of syringe you're using, we make sure every dose has been administered.
Thank you.
I believe I saw Senator Huff's hand up.
Yeah, do we know where is the hospital as far as their percentage of vaccines that they've distributed?
Yeah, so in talking with them yesterday, their plan for the end of this week's vaccination clinics, and I'm just pulling that up, because I think their goal is to sorry, let's see here. Here we go. Okay, their goal is by the end of this week to be to have administered at least 80% of their first doses. So by the end of this week, their plan is to have 80+% of their first doses administered.
Where are they currently at?
Oh, they're probably 300 short of whatever 80% is, because they have about 300 appointments scheduled today. And so I have to go through and look at their numbers. But when I asked them what their goal is for this week and what they anticipate that they'll be able to reach, they said by the end of today's vaccination clinics that they should have administered 80+% of the first doses that they've received.
Okay, thanks.
I want to mention to the group that several weeks ago, Senator Van Hollen's office called and asked if they could present to us next Friday at 10 o'clock. And of course I said yes. And then after a few weeks, I got a follow-up asking what we would like him to talk about. So I gave them 2 topics. One is status of the federal distribution plan. And the second is to talk about income insecurity issues and the federal relief package. So if any of you have topics you would like to add to that, please email or text me and we'll ask him to come prepared to either speak to it or ask questions. But clearly we need a better education on where the federal government is going, because that really affects our availability and distribution plans. Before we move on to the next topic, I want to call to see if anyone else has any more comments or questions on this topic. Okay, I want to thank Dr. Brookmeyer and County Executive Gardner for joining us today. We always appreciate an update and to have you get in the weeds and answer the details of our questions. Thank you.
Thank you.
Okay, the next topic on the agenda is the Frederick County Liquor Board legislation. You may recall there are 6 bills. We have had at least 2 conversations about these bills. So I believe that we are at a point that we need to make a decision. They have been drafted, but we need to make a decision as to whether, as a delegation, we want to move them forward. So the first bill under consideration is to correct the light wine Class B issue. Is there anyone that is interested in making a motion on that bill?
Move to, I guess, approve the, as a delegation bill, that bill.
Second.
Okay, we have a first and a second. Is there any discussion? Okay, all those in favor, either put your hand up or signify in the participant screen so that we can capture a vote. Then I am not going to move on to the next one till I know you're comfortable in capturing the votes. I don't see Delegate Krim, but we can get back to her later on this.
Okay, I have everybody else.
Okay, good. Delegate Krim, before we move on to the second liquor bill, we just voted on correct light wine Class B. Are you in favor of that bill?
Yes, that's fine. I just had to take a call, that's all. Thank you.
Okay, fine. Then that's unanimous. The second bill, removal of seating requirement. Is there a motion on that?
I move we don't approve that one.
Is there a second? Okay, the motion fails. Is there another motion on that bill?
I'll make a favorable motion on that.
I'll second.
Are we going to have a discussion? Because
Yes,
I'd like to hear the
Okay.
senator's reasons for his motion.
Delegate Krim, while you were gone, I mentioned, since we have discussed this twice, what we're going to do is move to a vote. And typically the way we do that within the context of Robert's rules is we have a motion, we have a second, then we have a discussion.
Okay, so we need a I'm sorry.
We have a second.
Okay, we have a
The
second.
senators.
So now's the discussion.
So I would have liked to had a discussion to hear his reasons for moving not to approve.
Well, I think just a point of order. So I think what Delegate Young is saying is there's nothing in front of us until somebody makes a motion in a second. And at that point, then we can debate it and discuss it. So.
Well, I can tell you, I tried to unmute to second and I didn't go as fast enough.
Well, it'll be the same thing. So it'll either on a favor or unfavorable.
Exactly. You'll have that opportunity when we vote.
Okay.
Okay, any discussion?
Yes.
Senator Young.
Okay. I see a trend going here that's bothering me. It's almost to open up alcohol to everything. We have had a seating requirement in restaurants of 50 seats for decades, and it's worked very well. We had a request, I think it was last year, because of COVID, to drop it to 28 for one particular restaurant downtown. And we went along with that. Now, 1 year later, they want to remove it totally. What I'm worried about that can occur, and I look at downtown Frederick in particular, we have spent years building that up, eliminating the kinds of bars and troubles that frankly they've had in Hagerstown and Baltimore, which we used to have in Frederick. And by the seating requirements, and it's basically someone having a drink with dinner or 2 drinks with dinner. We also removed the food requirement after 10 o'clock at night to help the restaurants out. So we dropped it to 40% for food from 50-50, and we removed not counting after 10 o'clock at night at all. So now by removing the seating, I'm just going to give a way out example. But what bothers me is do something like this.
There's one.
If something can occur, it's liable to do that. Someone rents a big space downtown where a business goes out, and they open a so-called restaurant. They don't have, you know, they can have one table and 2 chairs and a bar all the way around. And they can do enough food to handle that table during the day. And come 10 o'clock at night, there's no requirement. So all of a sudden, they get a music license, and it's a rowdy nightclub in the center of downtown. And I'm not against having a nightclub somewhere. It's not appropriate a lot of places, and downtown's one of them. It just opens all kind of possibilities of somebody opening a real little place on the other hand with 2 tables and serving a packaged sandwich and having a large bar and meet. And then again at 10 o'clock, all the rules go out. So I just think next year, I'm waiting for the next requirement to come in to make it easier. And what we've had has worked very, very successfully. And I just think it's a mistake to start tampering with it. And I can't support it for that reason.
Okay, I want to remind the delegation, if you're not speaking, please mute your microphone because we're
Mute your microphone.
background noise.
He's saying mute it, go in that lower right-hand corner and mute it.
Ms. Sugars, you want to make a comment?
Yes, respectfully, ma'am. I wanted to go back through for Senator Young to explain to him that beer and wine have no seating requirements. This was to create the consistency across the board from beer and wine, and beer, wine, and liquor. What I wanted to point out to you also, in this beer, wine, and liquor law 20-904, 80% of that flooring space must be used for food and consumption. So they can't just move tables around and just not have 2 tables. 80% of it has to be utilized for that type of function. That's one part of it. Also, we have some smaller establishments along East Street and downtown that can barely
go back there.
that can barely meet the 28 seats, and they want to have beer, wine, and liquor. They now have downgraded to beer and wine because they don't have a seating requirement. So just trying to create the consistency. I understand your concerns. I respect your concerns. But and Delegate Pippi, I know that you have some background on the 28 seats as well. If you could add something in, I would greatly appreciate it.
Delegate Pippi.
So I thought the Class B beer only and Class B beer and wine only are still at 28 seats. Are you sure? Because I thought we moved Class B beer, wine, and liquor to match them at 28, and we did that because at 50 seats it interferes with the fire marshal code, and we had a bunch of businesses that were going to be severely impacted. And look, I mean, to Senator Young's point, in the last couple of years, the delegation has been extremely flexible with changing a lot of these modifications because we moved it from 50 seats to 28, which had been in place for decades. We changed the food ratio to where basically they don't even have to serve food after 10 p.m. You know, I mean, I always yield more on the side of less regulation is better. And I understand that this is a regulation. I'm just, you know, I mean, Senator Young has a fair point in that the delegation has been very supportive of the licensed establishments in the last couple of years. I mean, I know because I've advocated for it on behalf of the liquor board and the licensees. So I just want to make sure you can confirm, Ms. Sugars, that, because I think the Class B beer and Class B beer and wine are at 28 now by law. unless I'm missing something.
Okay, what I have in front of me is 20-803, which is the beer and wine, and it has no seating requirements laid out in the actual scope of authorization. Same with Class B. I am not privy to or know how 28 seats may have gotten removed from that, but there is no seating requirement on these two particular laws. And again, I want to reference for the record, 20-602 and 20-803. This was to create the consistency with 20-904. So again, respectfully understand the concerns. We're talking about, again, we have some small, I don't want to say mom and pop shops, but they want to be able to, especially with COVID and trying to spread tables out and being a small establishment, they cannot get beer, wine, and liquor because of the 28 seats. And Senator Young, I'll let you speak here.
Thank you. Senator Young.
Well, I understand where Delegate Pippi got that 28 seat match, because when it was presented to us, we dropped it to 28 to match beer and wine. Now, I don't know what's in writing, but that's how it was presented to us. So I think that's why Delegate Pippi thinks that, because I thought that too. And I don't know of a restaurant. The only restaurant that had problems meeting the 50 was Wags. And it's small and crowded, and they had 50 seats, but with COVID, they couldn't do it anymore. And we accommodated that. Now, I have not, maybe the liquor board has, I haven't heard of any pressure from anybody to keep bringing it down, but I guess it only takes one person to come in and say, I can only do 10 seats. Can I get it? Or I don't know what these places are. I don't know what's on East Street that's asking for it. I haven't personally heard that. And as I said, this has worked for years with no complications. And I just don't think we should, we had an item brought up, and I'm just going to use this for an example. At the last meeting, it's not on the agenda. The cigar shops, they couldn't meet 40% food. So they were saying, could you bring it down to 20% for food? Well, if we did that, every restaurant could start selling a box of cigars and drop the food requirement to 20%. So every time we accommodate something like this for one business, it opens the door very wide for a lot of things. And I haven't heard of any real problems to start making these drastic adjustments like this. And I don't think it's necessary.
Senator Huff.
Just a question for the liquor board. Who was asking specifically for this? Do we know? Was there a business or?
We have a small Caribbean kitchen, Jerk and Jive, on East Street, and he's opened 2 locations now, one on Prospect and one on East Street. And with having a smaller requirement, his footprint could not meet the 28 seats. Therefore, he had to downgrade to beer and wine because that's where he had the allowable amount. So those were the 2 that came in and made requests. We have had other smaller restaurants with spreading out of COVID. I understand Senator Young's concerns there, where they could not fit the 28 seats when they do the 6-foot spacing. So I know we shouldn't just wrap this around COVID, but also the 2 meals a day. There are other requirements that are in the law that would keep them from, should keep them from, if it's, we're doing what we're supposed to be doing by inspecting these places, Senator Young, to keep them from having that type of atmosphere that you're speaking of. And I agree, you've worked very hard as a delegation to get Frederick County where they are today, and we appreciate it. We certainly do. This was to create consistency, and that's what we were looking for. Thank you.
Just one other question. I'm just curious, how other counties do this? I know when Senator Young and I were in Washington County, they were different. They have taverns. They had tavern licenses. I imagine Anne Arundel County, just from walking around here, what I've seen, at least Annapolis, they certainly have bars. I'm just curious, are there other counties that are like us with these seating requirements, or are we alone in this?
A lot of other counties have tavern licenses. We do not. So they have that allowable amount and do not have the seating requirements in every county. Now, can I speak for every county? I just know of a few that definitely have the tavern license and don't have the seating requirements.
So that's interesting. I mean, maybe that's another discussion. I mean, in that we've been grappling on this. Part of me thinks maybe we should table this for a week and go. I mean, this is a large discussion. I mean, this is almost like going to tavern license, which I know Senator Young doesn't agree with me on this, but I've actually always been open to that discussion. But that's a bit larger.
Would you like me to survey the other counties, the 27 other counties?
I think that would be great. I'd actually
Okay.
like to see what the other counties are doing. I mean, I wouldn't expect it, but quite frankly, even for, I was explaining to a senator last night that my district borders directly Virginia and Pennsylvania. So our people have to compete in my district with other states too. So, I mean, if you're looking that up, you wouldn't mind. I'd be interested to know what West Virginia, Pennsylvania, and Virginia do, just because we're competing directly. My constituents are.
I'd be happy to do that.
Okay, just as a matter of protocol, we have a motion on the table and a second. So is there a motion to suspend the rules if you would like to table this and bring it back next week?
Well, there's two other hands up, but maybe at the end of those two, when people are done, I'll be glad to make a motion to table.
Okay. Other people, not seeing other hands. Oh, Delegate Krim and then Delegate Kerr.
Madam Chair, I would just go with Senator Huff right now and table the matter. There seems to be some confusion, and I am only too willing to move that we table the matter to save time.
Okay. Everyone in agreement, we're gonna table this till next week and get some more information. Okay, let's move on then to item.
Well, we really should do that in form of a motion.
Yes, you're absolutely right. That would make me more comfortable. So let's first, would someone make a motion to suspend the rules?
We can make we can make a motion to table. A motion to table
Okay.
precedent
Override.
over favorables.
Okay,
I'll make that motion.
second, all in favor?
Aye.
Aye.
Aye. Okay, I think that's unanimous. Delegate Pepe, did you register on the motion to table? You can
Yes,
just-
aye. Sorry, my hand is hanging up there. I'll lower it.
Okay, thank you. And Delegate Cox, did you register? I may not have caught it.
Yes, aye.
Ben, you got everybody? Okay, we're going to table it till next week. Number C, item C, barbershop beauty salon changes the current serving of beer from 5 ounces to 1 bottle or can of beer up to 12 ounces per customer per day. Is there a motion on that item?
Motion to approve.
Second.
Second, discussion. Well, if there's no discussion, can we have a show of hands for those that are in favor? Okay. Senator Huff, did you vote on that? Well, you made the motion, so. Ben, do you have that? It looked unanimous.
Yep, I have everybody.
Okay, we're on to D. Off-premise consumption class B permanently allows establishments to sell to-go containers of alcohol after the pandemic. And Senator Young,
I would make a motion to extend it till the end of the pandemic.
is there a second on that motion? Second from Delegate Silberti. Do we want to put a time frame on that? I mean, how do you define the end of the pandemic?
When restaurants are released from requirements of COVID.
Okay,
Discussion.
any discussion? I see 2 hands up. I saw Delegate Pepe first and then Senator Huff.
I mean, this is just more informational for the delegation. So there is going to be a statewide bill that's going to do probably what we want to do. I mean, there's pros and cons to putting in a local bill, and there's also a statewide bill. But I will tell you, I mean, historically, there's probably not going to be a local bill. I mean, even if we put it in, you know, they're gonna probably yield to that statewide bill. So I don't know, just a matter of maybe saving some effort. You know, I'm open to do whatever, but that's what I was told, is that there's a statewide bill. There's some negotiation about it, and I'm sure that'll take priority over our bill. So.
And certainly if we see a statewide bill that addresses our needs, we can always pull our bill. Ms. Sugars?
I just wanted to reference for the delegation, that will be State Bill SB 205, if you wanted to reference it and look it up, that will go across the state, just informational.
Okay. Okay, so we have a motion on the table, a second
I'd like to speak.
I'm sorry.
Yeah, I don't like the amendment in that if we're going to do this, I'd rather do it in a permanent fashion. And as long as this is to go in that they're coming there, they're picking it up, it's not home delivery, but they're showing an ID and doing all that. I don't know what the big difference is between you go to the liquor store and you buy your liquor versus you're going to a restaurant and you're doing a carry out. So I don't know why we shouldn't just have it as a business practice. If you're going to take out, you know, Mexican food, you can take out a container of margarita. I don't want to end it just when the pandemic ends. These restaurants are going to need the help. The ones that make it through this, I think this will be a good business model for them. And I don't know what the downside, if people are worried about drinking and driving, well, you can go to the liquor store and buy your liquor right there. So if you were going to drink and drive, you know, people, they get around it. But the other thing is, as long as they're going there and showing an ID, I mean, I did it with Mexican food. I thought it was great because I took a container with me, and I think that should just continue afterwards. I think that was a good business model to be helpful for them.
Senator Young.
Yeah, I don't know what the full regulations are on this. I don't have a problem with what Senator Huff just outlined. If someone ordered dinner and they order a drink to go with it to take home, I'm fine with that. I don't want to get into a situation where after 10 o'clock when the food's off, and maybe this is taken care of, I'm not sure, so it's a question. But I don't want people at 1:15 when the bar's getting ready to close to just order drinks to take them out and drink them on the street. I have no problem if it goes out during the food time with food to do what Senator Huff said, to take home. I'm just worried about, again, where the rules apply and that people start walking out at night and drinking on the street. We have problems sometimes after a certain time on the streets anyhow, and this would just magnify it if they're out on the street with a takeout drink at 1 o'clock in the morning.
Ms. Sugars.
Yes, to answer Senator Young's questions and address his concerns, SB 205 does have in there that the food element must be a part of the to-go package. It cannot just be a drink to go. And also Frederick County, we will add additional regulations, which we already have right now, even under the executive order, that it must be purchased with a food element. So we are adding additional regulations to make SB 205 if it doesn't address the food element fully, because we don't want someone ordering 3 cases of beer versus 1 pizza. That's something that we want to address in our regulations, and we will. So to answer your questions there, thank you.
I appreciate that. And I don't want them also at a Mexican restaurant to get an order of chips and several drinks. So if it's tied with a real food order, I'm okay. So if that can be handled, I'd be okay with it.
Okay, is there any further discussion? Right now, Delegate Krim.
Thank you, Madam Chair. Why don't we just mirror what the state proposed state legislation is? And then if we want to make it stricter in Frederick County, the liquor board can do that. Is that right?
That is accurate. That is accurate. And I have been working with the bill drafter, and he is pulling in information from SB 205 for us.
Okay. All right. Well.
Okay. We have two choices at this point. We can either vote on the motion that's on the table, or that's in front of us, or table this conversation until we have the opportunity to review the legislation that might more accurately reflect where this delegation appears to be going.
I would be glad to remove my motion and take a look at where it's going and adjust.
Okay.
And just,
Yes,
Sorry.
Delegate Pippy.
I was just real quick, I read through some of the state bill, and it says for Senator Young's concerns, it has to be done before 11 p.m. They have to order food, and that does not consist of snacks. So it has to be an actual meal. So there's some good checks and balances in there, I think, if you're concerned. And if we just mimic the state bill and just put it in as a backup local bill, we probably should satisfy everybody's concerns.
I'm agreeable to that.
Okay, so we are officially going to, is there a motion to table this conversation till next week?
Madam, okay,
Go ahead,
go
I'm
ahead.
sorry.
Yes.
I was going to make a
I-
favorable on it.
Yeah, a favorable to model the state legislation. Is that, I don't know if ours right now, if our bill models the state legislation, but I think what I'm getting from our discussion, that if we model the state legislation, we're good with that in Frederick County. Is that?
Okay, and Senator Young did withdraw his motion, so do we have a second to Delegate Krim's motion?
Second.
Sure.
Second, all those in favor?
Aye.
Okay, good solution. Any further discussion before we move on to item E? Okay, seeing none. Item E, on-premise consumption Class A, an alteration to the tasting license that allows establishments to sell a small amount of alcohol for on-site consumption. This is very similar to Montgomery County's Class D tavern liquor store license. Is there a motion?
Okay, motion to approve.
Is there a second?
Second.
Any discussion?
Yeah, I have it.
Delegate Krim?
Would this come under what we had discussed previously, a tavern license? We thought we would table that discussion. Is that, I'm looking at my experts here on the delegation. Is that sort of the same discussion? Just asking.
Well,
Delegate Pippy and then Delegate Young.
This question is for Ms. Sugar. So right now, an establishment, a Class A establishment like a liquor store, has the ability to get a tasting permit. So for example, anybody can go into a liquor store and ask to taste a few items up to a certain amount, decide if they want to buy it or not. It makes sense. So this bill would enable the liquor store to sell a few drinks at full retail value, correct? And consume them on premise and then sell them on premise for retail value. Is that right?
That was the understanding behind it, but not a few drinks. They would be limited. And I, again, was working with the bill drafter yesterday to keep it limited. And I gave him the example of, and I'd like to give the delegation the example of what was given to us, is if someone's coming in to taste a bourbon, a special bourbon, and they don't want to taste it straight, they want to mix it with something, small amount of tasting to be able to mix that in a small, again, it would have to be limited, cocktail in order to see if they really like it in a cocktail type setting. This came from a request from 2 liquor stores that have a side patio, and it would open up the option of them consuming on premise a small amount of alcohol besides the amounts that were listed in the tasting. It'd be a little bit larger amount, not a full beer, not a full drink, but they were requesting that the ounces be increased on the tasting permit.
I mean, I don't know how we could vote on this without knowing the specifics, because I mean, just as a reference point, I mean, we would need to know the specifics on the amount and the organization, because it's, just to put this in perspective, there's hundreds of liquor stores, and I'm a huge proponent of these small businesses. I mean, I've literally bent over backwards to help them, and will continue to do that. But to some concerns that I've heard in this delegation meeting, just to open that up, I mean, they're not serving food. You know, they don't have kitchens, they don't have seats. I mean, so this is kind of in line with what we've been discussing over this delegation meeting about where we're prepared to go as a group. So I think we would need to see those very specifics in order to even be able to vote on this, in my opinion.
The bill drafter was going to be putting that together, and I don't know if he's presented that yet to Madam Chair.
Senator Young.
I agree with Delegate Pippi. I'm not opposed to this. I just want to make sure it stays in a tasting form. And I don't want somebody to come in and, you know, maybe it's a half a beer or a half a mixed drink, but have 8 half drinks or 8 half beers, because then we are getting into a tavern. In terms of a tasting room, try a few things like that with some limits. I'm good with it, but again, I don't want this to be, you know, creating the slope where it leads into a bar again. Next year we're back and that works nice. So let us serve full drinks and we got a bar. If it can be quantified and made a tasting room type thing, then I'm okay.
Delegate Kerr.
Would it be appropriate for me to table my motion pending further clarification?
Is there a second? Senator Huff has seconded that. All in favor of tabling this till next week till we get further clarification, put your hand up, please. This is looking unanimous. I'm assuming that Delegate Silberti's pen counts as a hand. Okay, we will be tabling item E till next week. And our final liquor bill issue, removal of styrofoam, removes the requirement of styrofoam containers in local statute as the use of styrofoam has been banned statewide.
So move.
Is there a second? Delegate Krim?
Second, I guess. Yeah, I guess.
Discussion.
Yeah, sorry, just discussion. I guess I'm going to vote for it, but I guess I don't understand that. Usually when we pass state laws, I guess because this is a state law, you have to go back and clean it. I just thought it superseded it and we wouldn't have to be involved with this stuff. I guess I'm just curious why we even have to vote on it. I thought it's just been superseded.
Thank you. I had the same question.
Yeah, I think it's just to take it off the books. The state law does supersede it.
It's just to fix the Frederick County Local 20-1013 to remove it. It's just to correct it.
All right. I guess because it's obviously an alcohol law, it's a state law. So you've got styrofoam in this part, not the other. Okay.
Any further discussion? All in favor, please raise your hand. That looks unanimous. Okay, so we will be discussing 2 of these bills again next week while we receive clarification. Now we'll be moving on to the final topic of our day. I had mentioned that this year we were going to try to limit presentations to information that is on a need-to-know basis with prioritization on the COVID pandemic. The United Way is very involved with so many of the issues that have been amplified by the pandemic, such as income insecurity, homelessness, food insecurity. And so they are going to be presenting today. We have Malcolm Fergal with us and Keith Harris, and they're going to give us an update on some ALICE information. As you all may recall, ALICE is asset limited income constrained employed. As of 2018, that was at about 37%. I am assuming that has increased significantly. And so I'm going to ask you, Malcolm, if you would lead your presentation on those items that are very much on the minds of our constituents today.
Thank you very much, Delegate Lewis-Young. And I'm going to pull up our presentation, and Keith's going to actually start us off. And I think I have the ability to share my screen. Actually, I don't. So I don't know if, Ben, you can give me that ability we discussed to share my screen.
Yes, 1 second.
Thank you, Ben. And Keith, if you want to go ahead and.
So while we're working on that, certainly want to say good morning to Madam Chair, Delegate Young, and Senators Ron Young and Senators Michael Huff, and the entire Frederick County delegation. It is our pleasure to join you this morning for this meeting. Again, I'm Keith Harris. I'm a member of the Board of Directors for the United Way of Frederick County and chair of the Advocacy Committee. Our president and CEO, Mr. Ken Oldham, would have loved to join us this morning. However, due to personal reasons, he was unable to join us. However, joining me this morning for this presentation is Mr. Malcolm Fergal, the Director of Community Impact and Grants for the United Way of Frederick County. And so this morning we are grateful just to have a few minutes to share our ALICE report data for Frederick County and how it impacts our advocacy platform. And so with that said, looks like we're ready. I'm going to go ahead and turn this over to Mr. Fergal to lead us through this morning's presentation. Malcolm?
Thank you very much, Keith, for that introduction, and thank you again for having us today. As Madam Chair mentioned, we know many of you are familiar with the ALICE report, so we're going to focus on the newest information to try to give you a baseline of where we were as a community before the pandemic and some of our observations of how the pandemic has affected ALICE households in the last year. I just want to quickly mention our many state partners for making this report possible. We put out this report every 2 years. So this report data we're about to share with you today came out last year in the fall and is 2018 data. As I mentioned, it's going to be a great baseline to look at for how our community has been impacted by the pandemic going forward. So we're going to review that quickly. We're going to talk about some COVID-19 impacts on ALICE households. And Keith is going to talk about some of our advocacy priorities for ALICE households that we wanted to share with you today. And hopefully we'll be very quickly done so we can have some time for questions and discussion. So United Way of Frederick County fights for the health, education, and financial stability of every person in our community. And we've actually been in Frederick County for over 80 years. And just a reminder that though we are a member of United Way Worldwide, we are an independent 501c3 nonprofit governed by a board of directors, which includes Keith Harris and Joy Schaefer is also on this call today. We have a strong commitment to diversity, equity, inclusion, which we strengthened last year. We actively oppose any forms of discrimination. We value and embrace what makes each person unique. And by focusing our activity on improving conditions for ALICE, we will positively affect the lives of underserved populations, especially those who are unable to afford a basic cost of living. And I just want to mention at this point that everything I'm sharing today is available on our website. You'll see that referenced on each slide there at the bottom center of each slide. So this is an analysis of Frederick County households. The ALICE report, I believe most of you are familiar with, like I said earlier, it does an assessment of the cost of living per county in a community, so much more localized data than, say, the federal poverty level, which is the same in all 48 continental states. So this, again, is 2018 data. So it does provide a critical baseline from which we can measure the pandemic's economic fallout and see where we were before the pandemic started. So quickly nationally, I wanted to share where we are with ALICE data comparatively to Frederick County. Nationally, before the pandemic, we had about 43% of households that were ALICE and below. You're going to hear me say ALICE and below a lot today. And when I say that, I mean inclusive of federal poverty. And you can see here 14% of that was federal poverty and the rest was ALICE. So for Frederick County, as Madam Chair mentioned already, we're at 37% with the 2018 data, 31% of which is above federal poverty, but below the cost of living in Frederick County, 6% of which is federal poverty, which was a decline from 2016. So we were happy to see that. But due to population growth, our number of ALICE households actually slightly increased from 2016 to 2018. So you can see this change over time and that percentage change I mentioned. This gives you an idea of how we've done as a community overall. We did have that one bump in 2016 of federal poverty, but otherwise it stayed around 6%. There were many communities that had a bump of federal poverty in 2016. I wish I had a full answer for you why, but at least you have that historical data here. So what is Frederick County's basic cost of living? You heard me mention it several times. So we update our survival threshold as part of that every 2-year analysis for single adults, families of 4, and other household configurations. And you can see here that for a single adult, our survival budget added up to annually $47,000, while a family of 4, and I want to stress this with 1 infant and 1 preschooler, so some of the highest costs associated with that family size would be $109,000 annually. And how does that compare to the federal poverty level? So just a reminder, the vast difference. You can see a single individual federal poverty in 2018 was considered at $12,000, while a family of 4 was considered in federal poverty at $25,000, regardless of the age of the children. So you can see the significant gap there between our local cost of living and the federal poverty level. So that's one of the reasons we have a challenge in Frederick County serving those in need, because many federal programs only go up to 200% of the federal poverty level, while our need in the county goes above that. And so that, if you ever wondered why we have so many nonprofits and so many services in demand in Frederick County, that's part of the reason. So we have less federal investment proportionally than other communities for those individuals in need, as many of them don't qualify. One exception to that is the health exchange, the Affordable Care Act health exchange that Maryland has. Some of those benefits go up to 600% of federal poverty, but other than that, most programs go up to 200%. So this is a quick rundown of some of our communities. You'll see that Emmitsburg remains the highest percentage of ALICE and below, 56%. City of Frederick at 50%, which is a slight decrease for the City of Frederick from the 2016 data. And you can see communities like Urbana remain at the low end at 14%. So this is good to see just very quickly, to see that even within Frederick County, there's many different stories. And the communities are very different from each other, just like within the state of Maryland, every county is different. So I always like to stress this because it's another reminder why we need to look at alternative tools to the federal poverty level to get a true assessment of how our community is doing. The data under county data, that is 2018 data. So to correspond with the 2018 data I'm sharing from ALICE. So you can see one of the other things we talk about as a concern is the housing burden of those paying more than 30% of their monthly income on their rent or their mortgage. And you can see for renters, it's now over 50%. So it was below 50% for the last few years. And so we're very concerned that for the first time, the 2018 data suggests that renters in our community are paying more than 30% of their monthly income on their rent. And that is a challenge for obvious reasons. So you can see here, our unemployment rate was very low in 2018. Our health insurance rate was very high. It had gone down slightly because it was the first year that health insurance wasn't required. So that had gone down slightly, but not significantly, about 0.5%. And for our community, compared to other communities in Maryland, voter turnout and preschool enrollment is pretty high. And the median household income is very high. But as you can see, the ALICE data doesn't tell the whole story. So very quickly, I just wanted to show that City of Frederick does have most of our ALICE households. You can see on the left there, that shows the bar graph, the number of households in the city and how many are ALICE and below. And on the right is the rest of the county, but the City of Frederick is the single largest source of ALICE households in the county. And just going through these very quickly because I know we don't have much time, but this shows that we do have a breakdown by age. So if you're interested in that information, we have that available both by percentage and number. And one of the concerns we have is the growing ALICE senior population, which presents certain challenges. And I also want to mention that it's quite normal for the percentages to be so high for under 25-year-old households as they're early on in their career. And so you want to see is that percentage drastically going down as people age up into their highest earning years in the workforce, which you do see here. But again, the concern is on the other end with the growing senior population. So this shows you the breakdown between different types of households of children in the community. And just as with before, single mothers and single father households are some of our biggest concerns. Single mother households, especially 79% of them are ALICE and below in Frederick County, which is a little bit higher than the state average of 75%. So that remains a significant concern. And 23% of married households of children are ALICE and below, which is much lower, but it has been creeping up slightly every 2 years. Here you can see the breakdown by race and ethnicity for Frederick County ALICE households. And you can see that the white and Asian households are close to the county average of 37%, just slightly below it, while the Hispanic and African American communities have a higher percentage of ALICE than the county average. And the African American household percentages have been staying pretty constant, but the Hispanic percentages have been increasing recently. I just want to emphasize, though, that despite those percentages, as far as number of ALICE households in Frederick County, because we are a predominantly white county, we have the largest number of ALICE households by race and ethnicity is white ALICE households. So just wanted to stress that here. You can see that clearly in this chart. And just very quickly, I wanted to mention, because you probably are wondering, where is the disproportionate representation? Because that kind of gives you an idea of where you should target your efforts. So for Frederick County, our disproportionate representation of ALICE households come from our seniors, which I mentioned already, and our single female households. They're the biggest disproportionate representation. Basically, wherever you see an orange graph be larger than the blue graph of each category, that's where you know there's a disproportionate representation of those households in the ALICE community. And you can see on the other hand of that, white households and married households of children are slightly underrepresented in the ALICE population in Frederick County. So I know I find this data particularly interesting because I think it gives you where you can take some action to make a difference. So just to stress again, who is ALICE? It's people you see every day. It's retail clerks and stock pickers, restaurant staff. We talked about, I know you're talking about nurses and teachers earlier today. Sometimes they can be ALICE too. Hotel staff. Not coincidentally, what did a lot of these folks have in common? They've been disproportionately negatively affected economically by the pandemic. And as you see there, anyone who's experienced job disruption or other health problems from the pandemic may have found themselves newly ALICE in the last year. So I promised you I would talk about COVID-19 and ALICE, so I'm going to do that very quickly. Obviously, as I just mentioned, since a lot of the jobs that folks have who are ALICE are those that either been scaled back or puts them at risk of getting COVID-19 higher than the other population who can work from home. There's health concerns, there's unemployment concerns. We've had a huge increase, as you know, in food insecurity in Frederick County, which we've been glad to see a huge coordinated effort to increase our food bank distribution and meal distribution from the school system as well, which we're very grateful to the Frederick County government for putting out a map to show all those resources recently that's interactive and online. That also can include the ALICE data, by the way, if you want to look at that. Housing is an issue that we need to stay on top of because it's going to become more and more of an issue as things change if eviction moratoriums are lifted. At the moment, it's not become the crisis it could be, but we have heard anecdotally, and I'm working with a family this week, for example, where because of various loopholes or other things, they are having challenges maintaining their rentals or finding new rentals if they need to move for various reasons. And so there are people having housing challenges, but thankfully the moratoriums on evictions and some of the actions taken on the federal level on mortgages has helped a great deal, prevent it from becoming a true total crisis. Childcare, though, many of the workers who are ALICE need help with childcare, and as you know, there's reduced childcare capacity at the moment, so that is a big concern. And transportation has been a challenge too. Thankfully, most of the reductions in transportation have been eased, but we've also seen a reduction in available rideshare services, which can sometimes put the costs of those rideshare services up as people have more demand in their surge pricing. So those are some of the concerns ALICE households have. And then some quick data points. This is gathered from a variety of sources, but I just want to share some quick data points here. From our local 211 call center, we know, and this is the most recent month I have data available, I apologize, but I checked before our meeting and it was 33% of calls in October for healthcare reasons, 30% for behavioral health, and those have been increasing from previous months, and 29% of COVID-19 are COVID-19 related. That actually was a decline from previous months, but I've been told by the call center here in Frederick that those calls are now the majority of the calls again. So when I have that data confirmed, I'll be updating this. But growing the percentage of calls for housing, rent, or emergency shelter assistance. And again, this is when people were hearing that some of those moratoriums are being lifted, but thankfully those have been put back in place at the moment. I did want to give you a quick snapshot too of unemployment. You can see that right now the latest numbers have us at 5.4%, which is actually a big drop from 6.2% we were in October. The highest point we were during the pandemic was 9.5%. All that though still being significantly higher than where we were in March 2020, which was a very historic low of 3%. So that's still a concern, definitely impacting Alice households. And as we know, unemployment data doesn't always show those who are given up seeking work. So I went over a lot, but I'm going to stop there and hand it back over to Keith. He's going to mention some of the items we've prioritized for our advocacy platform to help Alice households.
And so with the Alice information, the data that's contained in this report, it's really changed the way that the United Way for Frederick County approaches the community needs and how we go about working to meet those needs. And so as you've seen through the report, it really costs more to afford a combined cost of living, just basic living needs. And so this COVID pandemic has just exacerbated those realities for our Alice households and families. And throughout the data that Malcolm shared with us, we are especially concerned for our seniors, for our single mothers, for our Black African American and Hispanic populations, as these are some of the populations that are overrepresented in our Alice population. And so that has driven our 2021 advocacy priorities. As you see here on the screen, we are really concerned about the COVID-19 vaccines. And I know that you all have had ongoing discussions and will continue to have discussions about the vaccine distribution. You also see there some other advocacy platforms that we have there. And again, all of this information is contained on our website. And during our discussion period, if there are questions that you have about any of these, we'll certainly be able to address those.
Thank you very much, Keith. And I think that's where we'll finish things up in case, so we do have some time for questions. And as Keith mentioned, those websites have the information we went over, both the Alice report, I believe you were emailed that before today with this meeting's information, as well as our advocacy platform, which is also always available on our website. So yeah, so if we have time for questions or discussion, we would be happy to take them.
Thank you very much for that presentation. I know many committees are starting to vote already, so it is very helpful to have a local snapshot of some of our greatest challenges. I'm going to ask Ben if you could take that presentation down so that I can see if any members of the delegation have any questions. Delegate Krim.
Thank you, Madam Chair. I saw your unemployment statistic dates to November. Do you have anything more recent?
Thank you, Delegate Krim. I actually checked that this morning, again, before the meeting, and on the Maryland Department of State Labor website, that was the newest month that I had data available.
Okay, and what do you know about people not getting their unemployment insurance benefits? I know at the state level and all of our offices have been assisting constituents in trying to get their benefits. What have you heard about that?
Yeah, we've heard from folks anecdotally that they have had lots of challenges accessing their unemployment benefits. Thankfully, the number of those we've heard has gone down over time. We were hearing quite a number in the beginning, early days of the pandemic. But we are still hearing some. I was just talking to Delegate Lewis Young about a family last week, and she was emailing me about somebody over the weekend. I have found that Congressman Trone's office has been very helpful, and as well as other offices, as well as many of you, helping folks access their unemployment benefits. But it does remain a challenge, and sometimes it's an informational issue. So, for example, one family I'm working with, they were trying to get their unemployment benefit because they were, lost their job due to the pandemic. But then when they were dealing with the unemployment office, they're like, well, we see though before the pandemic you applied for this other job and you chose not to take it. Can you tell us more about that? And they're like, wait, okay, well, that's great, but I lost the job I had during the pandemic, so why are we worried about what happened before? So the different situations like that are coming up. So yeah, it still is an issue, but we feel better than it was earlier.
So I just want to tell you that we all stand at the ready to assist. So don't hesitate to tell people that you interact with to contact us if necessary.
Thank you very much, Delegate Crum.
Any other questions or comments from the delegation? Delegate Cox.
Thank you, Madam Chair. Thank you, gentlemen, for your presentation. Real quick, two things that stood out to me that I wanted to ask you about. First of all, was concerned. Obviously, it's a concern of mine from Emmitsburg being at the bottom. Having that part of the district. Obviously, I represent that area, and that's a concern. But appreciate what you're doing to provide options and services. Absolutely support the broadband expansion. But I noticed that in terms of actual poverty, something that jumped out to me was that the African-American poverty rate was almost double than anybody else. And I wondered if you could explain why. And then secondly, do you have resources for small businesses? I am very appreciative of the options and resources that you listed. And I didn't know, I know there's quite a bit of options out there to help people receive minority grants for businesses, receive different funding opportunities to launch a business. And that kind of independence can really help the market rather than just increasing services, having options for people to really embetter themselves with their own business ownership. Didn't know if you provided any links or opportunities or training in that regard for the Alice population.
Thank you very much, Delegate Cox. And there's a lot there, so I'll try to address it all, but let me know if I missed something. So yes, you're correct in that observation regarding African-American households and the poverty rate. And if you go, one of the attachments you were sent before today should have had our full report for Frederick County. And there you can see for all the different demographic breakdowns, the historical history of the poverty rate and Alice rate for each demographic. And in African-American households, it's gone up and down. So for example, it was at 9% in 2010, up to 12% in 2012, but then it's actually been going down since then. So went down to 11% over 2014 to 2016, and now down to 10%. So we're actually not happy it's 10%, but we're also happy that it's come down from over 10%, and hope that trend continues. Not just hope, we obviously are working hard and our partners on that. Specifically, we've also seen the Alice percentage go up then down in that population as well recently. So we're actually, if that trend continues from 2016 to 2018, we're happy with that direction, but not happy with the numbers where they are, if that makes sense. While I said earlier on the historical data trend for the Hispanic households, we've gotten increasingly concerned that percentage both for Alice and poverty has been going up over time rather than down. So we're concerned about that trend, for example. So those are two observations I wanted to share, and again, reference that full PDF you have. I think you also mentioned small businesses and what support's available for them. That we have in the past, through our Financial Stability Center called the Prosperity Center, operated some small business startup funding assistance. Unfortunately, the funding for that has run out, so we aren't able to continue to offer that program. But we did have some success stories with that, and it was a match savings program through which we also provided, coaching and other supports to develop their business plan, et cetera. So if we could find, and we are always actively fundraising and looking for more funds to replace the funds that we use for that program, we'd be happy to bring it back. So we have run one in the past, but at the moment don't have a program. We do have programs to help with housing, car ownership, tax preparation, budget coaching, and credit counseling for individuals at the moment.
What was the primary source of that Prosperity Center? That's a great program. It's too bad that it's run out of funding. What was the main source of funding?
For the small business part of it, yeah, it was federal funding. It was federal funding. So through their.
Did Congress not renew the grant or something, or was it a grant that just ran out that you need to reapply for?
It was a grant that ran out, but it was also a program that the federal government hasn't prioritized recently. It's the IDA program, the Individual Development Account Program for the Department of Health and Human Services, which had seen a lot of support in the past, but the amount of money available has declined over time. And honestly, we just had a really hard time getting any word back from that department when we had questions about the future. So all of our funding at the moment, we feel much more secure about, because the programs we do have is more locally funded. And so we have more direct relationships with those funders.
Thank you.
Thank you.
Any further questions? Thank you for the presentation. That was very informative, very helpful. Please feel free to send us updates, and thank you for being a resource. We'll now move on to our final topic. Delegate Cox has a bill to present.
Thank you, Madam Chair and members of the delegation. I'll be as quick and brief as possible here, because honestly, this was something that has been reviewed. This was reviewed last year, if I'm not mistaken, and initially approved for the initial drafting. It never came back because of the pandemic, never came back for a final review and delegation. You were sent a copy of last year's draft, which came in late last year, and then it is in the process of being updated with the present language. I do have a gentleman online from Thurmont, Mr. Andrew Polera, who will explain the purpose of this, but the gist and the focus is to protect residents in Frederick County with children from child sex offenders living within 1,000 feet of a school or a child care facility or a park or a playground or a bus stop, and or a similar place to those effect. And the reason for that is it has unfortunately come to my attention, as I explained last year, and as Mr. Polera will explain, that there have been registered sex offenders that have located very close to some of these facilities and have even allegedly installed cameras, catching the children on cameras, and that's been alarming. So with that, I would ask Mr. Polera to explain to the delegation the purpose of the bill.
Okay. Thank you, Delegate Cox, and thank you, ladies and gentlemen of the delegation, for giving me this opportunity to speak about this. So we are looking to enable legislation for residency restrictions for adults who are on the Maryland Registered Sex Offenders List. Maryland is one of 12 states that do not have any residency restrictions in place. Maryland also now ranks 10th in the list of states for the most child sex abuse victims per 100,000 children. So definitely seeing a lot of statistics that really are concerning in the population and the number of people being hurt through these very horrible crimes. So these residency restrictions will help protect our children in the communities by ensuring that they have a safe place to work, to live, to play. So we currently, Maryland requires anybody who has been convicted of one of the sexual assault or sexual offenses, they must register with the state. So we require that for them. And the reason for that is to protect the community. And even on the disclaimer for the Department of Public Safety and Correction Services, lists, when you go to look up a registered sex offender, it says this is done to protect the community. So we have some things in place for that. We're just looking to now take it, the next step further. Maryland also has a law in place to where you cannot, they cannot enter property for a school or a childcare. So we recognize the boundaries of those areas. We're just really kind of looking to now expand those boundaries to better protect those areas. Similar, Maryland has school speed zones to protect the children while they're going there. So there's lots of current things in place, recognizing the need for this level of protection. So we're now just looking to introduce legislation to now provide the residency restrictions.
And Mr. Polera, thank you so much. I just wanted to mention again, I think we mentioned this last year, but this is similar legislation to surrounding states. Is that your understanding?
Correct. Pennsylvania, Virginia, West Virginia, Delaware, all have similar requirements in their states. I have a list of all the different states, and I'm trying to think of the closest one. I think Vermont may be the closest one that does not have something in place. So this is, like I said, a very common, requirement in most states.
Thanks so much for your time.
Yes,
Thank you.
thank you.
Are there any questions from the delegation? Delegate Kerr?
Yes, I'm curious as to why this is being introduced as a county bill and not a statewide bill.
That is an excellent question, Delegate Kerr, and I know it originated from a request from Thurmont, and I think that we certainly could potentially put it in as a statewide bill, but I think that the interest was to make sure that the delegation was on board, and other jurisdictions within the state of Maryland may have their own local interests. So it was, I think, an attempt to avoid any kind of stepping on other people's interests in that regard. Local rule issues potentially, but maybe Mr. Polera would have a better comment on that as well.
Well, the examples Mr. Polera gave were all bordering and states, not municipalities or individual counties.
Yes, so I can speak to that. So there is no law currently within Maryland for this, and there are, so like in Pennsylvania, for example, they do have their law allows each county to set their own precedents, set their own requirements. New York is another state where they do allow the counties to set those requirements. So it's not necessarily a statewide requirement, but they do offer, those counties the ability to enforce those requirements. So the request would be, to, at least give, Frederick County the ability, and, if other counties want to join, great, produce a statewide bill. I think that's definitely something else.
Any other questions? I thought I saw Delegate Krim's hand up. Delegate Krim.
Thank you, Madam Chair. So we may be trying to put the cart before the horse here. I'm following up on Delegate Kerr's question because I had the same reaction when I was hearing the bill. This is a statewide issue, I believe. And maybe we could get legislation that says that the locals can do their own, but we don't have that yet. So I'm going to suggest to Delegate Cox that he put in a statewide bill on this topic. And then perhaps we can go from there. You're on the perfect committee to do that, Delegate. So that's what I would suggest, because we do have sort of a policy in the state that locals don't do bills that have statewide implications. I mean, statewide bill, it comes in as a bill to a standing committee for statewide policy.
I don't have a problem. Thank you, Delegate. And I don't have a problem with your comments and Delegate Kerr's comments and suggestions on that. And I'll certainly look into putting it in that way rather than as a delegation bill. But it would be helpful, I think, in whatever committee it ends up being assigned to, if if the Frederick County delegation indicates its support for that. So if that would be a possibility to maybe I can talk to Madam Chair about a letter of support if the senators would also be in support. I think that would be a great move for the town of Thurmont. I know that it's a potential local issue in that there is local rule, but I'm absolutely fine with starting the conversation with a statewide bill. If
We could, I will just mention, we could sign on as co-sponsors. I mean, that's how we would do it. We wouldn't sign on as a delegation, but we all could sign on as co-sponsors.
and that would be fantastic.
Okay?
All right.
Okay, if you would update me when you get the draft back, because that will tell us, you know, how we look for the flexibility to convert it into a statewide bill.
I'll do that, Madam Chair. Thank you.
Thanks. Any other comments on this topic? Okay, public comment. I know we have one that was put into the chat. Malcolm Fergal put in the public chat that he hopes state funding will be made available for payroll protection. And he also asked that we announce that the United Way is conducting a survey to assess the impact of COVID-19 on the county. Ben, I'm going to ask you if there are any other comments from the public in the chat.
No, there is not.
There's not. Okay, thank you. And I want to thank Ben. Ben Reese is my legislative director, and he has been extremely helpful in the technical and administrative aspects of this meeting, which of course is critical to a smooth meeting. So thank you, Ben. Our next meeting will be on January the 19th. As I mentioned,
Today.
Senator Van Hollen will be joining us. We will continue with the alcohol bills, and we will be bringing the county bills forward at that point in time. I do have planned in the future a presentation on the status of our business community. I have reached out to the Chamber of Commerce, specifically CEO Rick Weldon, and perhaps other spokespeople for the business community. I think it's very important as we get into legislation, particularly as it affects the state of business in our communities, to have that local perspective. But we'll just see in terms of timing if that fits next week or the following week. So before we adjourn, I'd just like to give the delegation one more opportunity for comment.
Madam Chair, I think you meant January 29th is our next meeting.
What did I say?
19th.
You're correct. Thank you. That happened already, January 29th. Okay, thank you very much. Do I hear, Delegate Cox, do you have a, yes?
Just a quick follow-up, Madam Chair. Thank you. My staff reminded me that this year, because of the pandemic, they're not offering co-sponsorship. So I'll talk offline with you if the delegation would be interested in a letter of support. So thanks so much.
Delegate Cox, I don't know how your committee handles it, but the way my committee handles it, when we vote on something, we then have an opportunity to sign on other co-sponsors. So I do think there may be a backup for that.
Sign on by amendment.
Yeah.
By committee amendment, you mean?
Yeah.
I'll check it. I'll check with my chair on that. Thank you.
We'll talk offline about how to do
Thanks so much.
Thanks so much. One last opportunity. If no further comment, do I see a motion to adjourn?
So move.
Okay, Senator Young, Senator Huff had his hand up. So would you like to officially do the second, Senator Huff?
Yeah, I second.
Thank you very much. Have a good week. We'll see you next Friday